proteomics is compared to genomics or epigenomics or even metabolomics. I feel we have the data. We can look into the genomics, epigenomics, and other omics, but the closest omics to the phenotype of a disease is, of course, metabolomics. But the metabolomics is a bit, there's exogenous and endogenous metabolites, so it's a bit, it needs a lot of filtering the metabolites before you can really classify, and there's a lot of exposure. So, but proteins are especially the human proteomic reference data is just based on human proteins, so we can, it's at least one step closer to the phenotype, and it can tell us the disease proteins that are very specific to that patient population, in this case migraine. And compared to genomics or migraine is of course a heritable condition, but there are hundreds of genes that have been identified. It's definitely considered to be a polygenic disease, so it becomes very difficult to really use genetic data to classify patients that were for a disease that where hundreds of genes are already identified. So it just makes the classification more challenging. But proteins and proteomics are much cleaner, especially the way we found the results, about 90-95% accuracy in classifying, correlating to the frequency-based classification of episodic chronic migraine. And we felt that's the better approach compared to the other omics.